Thank you very much for your kind introduction. And it's always a pleasure to be in Athens. Maybe I should start with two personal notes. You know, when I woke up this morning in this beautiful hotel and was looking out of the window, and there it was, the Acropolis, and I knew exactly that I'm in Europe. It's so wonderful to be here, and I think nothing can take away the dignity of this country, you know, looking at the Acropolis. And my second personal note is maybe, I'm coming to these eHealth conferences quite a bit, and I always liked the industry guys. I was in Sofia recently, and it was not Microsoft, it was another big international industry, you know, and he told the poor Bulgarian audience that buy my device and cancer will be eradicated in Bulgaria. And I thought, gee, congratulations. So I'm always sometimes I'm amused, you know, how optimistic these friends are. Ladies and gentlemen, I'm talking here, we have two hats. Once, yes, I am the Director General of the Ministry of Health in Vienna, in Austria, and in this capacity, I am a shepherd dog running around the herd in my country, implementing eHealth solutions. And we have this big lighthouse project of us. You know, we implemented almost 10 years ago the electronic health card, which is up and running since more than 10 years. In the meantime, 100 million times tested in reality, which created an interconnected space with all the healthcare providers and health insurance funds, which was a good accelerator for then the other forthcoming projects. And our second lighthouse project is a national electronic health record system, cross-sectorial, outpatient, inpatient, mandatory, opt-out solutions. So I have my shepherd dog's experience, and my second hat is that I am the co-chair of the so-called eHealth network. I will talk about it a little bit later. And the member states, so Greece and other member states, thought that it is a good idea that I'm chairing this eHealth network. You invited me to talk about the evolution of the legal framework of eHealth in the European Union, and you know I'm not a representative of the European Commission, I'm a member state representative, and I'm also a civil servant. And as a civil servant, I'm obliged to follow the rule of law, and I think this is, next to the Acropolis, one of the other good heritages in Europe, that we all live according to the rule of law. And in that perspective, yes, we do need, this is, you know, the slides shows it with a question mark, but yes, we do need a legal framework for the national, but also for the cross-border exchange of health data. And why? It is easy and simple, because health data per definition are personalized data. And I think this is very correct, and as a political scientist and a lawyer, I have to say, yes, this is also very good, that health data is personalized data and needs the highest level of data security and data protection. I think this is a human right. It's not that easy. It's not that easy to manipulate and work and use personal data and health data. I think that's correct. But be very strict on this side. You know, there is a balance. And I think, and this is what we in the legal systems and the regulatory systems have to be very aware of, there is a large, important public interest that we all exchange health data. And the slide tells you a little bit the story behind it. And I think this always, we the regulators, you know, we always have to, you know, find this balance. What can we do and what can't we do? But I think it is obvious, and it is a public interest, that the exchange of health data, not only national but also cross-border aspects, improves the availability and the medical information leading to a quality improvement of diagnostic and therapeutic decisions, treatment, and the continuity of care. And the quality aspects linked to that are undescribable, and they are evident. So there is a public interest. And let me say one more thing. From the patient's perspective, from the citizen's perspective, the exchange of data is a mighty tool, and probably the only tool to strengthen patients' rights. With the access and the accessibility of health data through the means of ICT, you really provide the patient empowerment and on a very, very effective and high level. So these will, in the moment the patient has access, digital access to health data, that changes the game in many, many, many aspects and empowers the patient toward also the healthcare provider. So we are talking about Europe here, and where is the marketplace? What is the shared space where the member states collaborate? I don't know if you're lawyers and if you're always if you dig into the legal texts, but the cross-border directive, the Patients' Rights Directive from 2011, in this Article 14 has a chapter, an article, so to say, about eHealth. And one of the key elements in this article is that the competent authorities of the member states of the European form an eHealth network. And actually, this is one of the rare occasions in the health sector that we have a platform on a legal base, where we, the competent authorities of the member states, the ministries, my colleagues sitting here, we are always meeting in that meetings that we meet in this eHealth network, and where we can collaborate. And one of the objectives of these eHealth networks, you all can read, is to improve the interoperable applications with a view to achieving a high level of trust and security. So it is all about, in the cross-border perspective, it is about interoperability. It's about interoperability. So the eHealth network is the one instrument, a powerful instrument, where the member states of the European Union can come together and share their views, share their experiences, and create policies toward these enhancements of interoperable applications. We do have a multi-annual work plan, and for 2015 and 2018, and it wouldn't be the European Union if we wouldn't have a joint action to support that activities and to prepare these activities as we usually do and that's how we operate in the European Union, because this is also the way to include the European Commission in that work. But one point I would like to strengthen here, and you see that this eHealth network is co-chaired by the Director General of DG Santé and a member state co-chair, because some friends of mine and personally me, we always thought, and this is very important, that this collaborative process in the European level has to be in the ownership of the member states. It's not, the Commission can support us in many, many ways, but it has to be in the ownership of the member states. And the presentations I saw in the morning is the answer why it is that way, because it's the competent authorities in the member states who implement and deploy solutions and applications. It's not the European Commission. It's not even sometimes the central governments. It's the competent authorities on the ground. The evolution of the discussion. We talk about interoperability, and I'm very pleased that a couple of weeks ago, I think last week actually it was, in one of our meetings we were able to adopt an eHealth European Interoperability Framework, a refined eHealth European Interoperability Framework. And, you know, the document is not solving any problems, no, but the document should help us on the European level, but also on the national level, to structure the debate when we talk about interoperability. It structures the debate because it defines the different layers of interoperability. And here you see there are 4 layers. You know, there's a legal question of interoperability, there's organizational, semantic, and technical. And each of these layers are important, you know. There is no interoperability only with legal interoperability, or there won't never be interoperability only with organizational measures or semantic measures or technical measures. You know, we always have to bring all the 4 layers into the limelight. And for me as a policymaker, you know, when I'm approached by a producer or the industry, you know, and they tell me the blue sky is wonderful for a certain ICT solution, you know, I always can ask them, you know, how does it fit into these 4 different layers of interoperability in the health system, you know? And this is why this, I think, you know, it's not, it structures the mind and it helps us decision makers, policy makers, to distinguish. And you know, and there it's that's where it says the organizational layer of interoperability. It says policy, and I think we missed the one vocabulary. It's also a cultural question. You know, when our Italian friends were telling about the Veneto and the reluctance of generic practitioners, you know, to provide the important information to summarize, then it's a cultural question, friends. It's not a legal question, it's a cultural question. I don't know why, but some medical doctors are still very reluctant in using ICT. Very reluctant. I don't know why. And this is a cultural question. Maybe it's a fear, it's still the fear that ICT creates a transparency. And transparency is sometimes, you know, not very pleasant. You know, we all like to hide behind the paravents of intransparency, and that maybe a peer, a colleague, another medical doctor can see what a certain doctor does or not does, you know, so it's a cultural question. So this should be also, I think, mentioned if we talk about interoperability. Let me go into these different layers very quickly, and I don't want to be too pretentious about it, but I think it is a prerequisite, and technicians sometimes forget about it, but it is a prerequisite that we have sound, sustainable legislation, regulation, if we talk about exchange of health data. It is a prerequisite. And see, we have to, you know, there is a lot of regulation out there. Is the general data protection regulation. It's European law, national law, mostly European law, to regulate that. We will have a new legislation pretty soon coming, which will not be a big obstacle in the health sector, but it's there. We have to fulfill one other very important prerequisite if we talk about the exchange of health data. Exchange of health data. I'm not talking about the health data within the premises of a healthcare provider, but I'm talking about the exchange of health data, the data exchange between healthcare providers and the access of a patient. We have to regulate the patient autonomy. Once again, health data are personal data. They are the master of the data are the patients, and we have to regulate that. So my plea is to all of us to be very, very careful and have good and sustainable legislation nationally, but also on the European level. And the cross-border aspect of exchanging health data is even more complex. You need national legislation to that, but we also need support on the European level. What we're doing right now, and this is an intellectual, really challenging process for all the lawyers involved, we are working on a multilateral agreement to create an environment of legal and trust for the European exchange of health data. Yes, we do have some European regulation which helps us, especially with e-identification and so forth, but there are many, many other issues we have to think about. You know, we have to create this space of legal trust and security if we exchange data cross-border. You know, to make it more exemplary, you know, if you exchange data between Austria and Greece, you know, the Greek side and the Austrian side, vice versa, they have to trust that all the functions behind, you know, are sound, are within a legal framework, within a technical framework. We need to create this and so forth. We need these multilateral agreements which should then harmonize and merge the national legal necessities with the European necessities. I hope that we are able to solve this problem by 2017. A really good group of national lawyers from member states are working on this project. It's headed by the Swedish Ministry of Health, and to come up with good solutions. Another point is this organizational interoperability. You know, I'm talking in a legal framework. Ladies and gentlemen, without sound and good regulation and to regulate electronic identification for patients and healthcare providers, we never will be able to have a secure and safe system to exchange health data. We do need good regulations on that. And this is, you know, I didn't make my homework and didn't study the Greek regulations on electronic identification of patients and healthcare providers. I didn't do it. You might have wonderful legal solutions already, but I am only saying without that, we can't do it. And we can't do it in the cross-border sector. I do many, many member states, and this is the majority of member states, who don't have good regulations on this. They don't have a good regulation how to regulate patient registries or digital patient registry or digital healthcare provider registries. It's a majority of member states. And until we don't have these regulations in the national level, we will never be able to exchange health data in a cross-border aspect. Because we have to identify patients, we have to identify healthcare providers in this circle of trust. It's all about identification, authentication, and authorization. Ladies and gentlemen, this is homework. This is a prerequisite we have to do on the national level. Maybe you solved this problem in Greece already, then congratulations. Then you would be one of the few countries in Europe which have done their homework. But this has to be done. So the next issue is semantic interoperability, and you know, in the legal context, there's not much to say, but it's everything to say that we do need e-standards, and I think the ICT in health is a wonderful accelerator in standardizing the products healthcare provider are producing in terms of files. You know, this is a good thing. You know, this is a good thing. You know, 20 years ago, probably each and every hospital in Europe had a different format for discharge letters, you know, or discharge documents, or each and every lab had its different paper version of the lab results. You know, this is wonderful that ICT is pushing to standardization. This is wonderful, but you know, it wouldn't be health. You know, the health sector is one of the most complex sector. We in the meantime we invented the system invented so many terminologies, languages. We are not talking about German and Greek and English, other languages. We have to harmonize them. See, and what we are working on, and this is one of the projects we have in mind, is that we do need master catalogs on the European level, that every member states can draw these terminologies, ontologies, map them, share them, and translate them and transcode them. This is one of the projects we are organizing on the European level in the interest of each and every member state and each and everyone who is working on eHealth solutions. Ladies and gentlemen, we do need, but there is also regulation needed, because at least we need the framework, a legal framework for agreed international standards and profiles and formats for this exchange. The technical layer of interoperability, there I would like to emphasize that there's a good European development for us, the member states, on the way. You all know about CEF, this Connecting European Facility. It is a part of 1 billion euros, where a little bit is also reserved for the health sector. It's not much, and for the first 2 or 3 years, it's 7.5 million for generic services. But see, here it's a good showcase why it's so important that the member states collaborate. Because we, the member states, said, okay, the European Commission with their fantasy how to spend this 1 billion euros, they talked about the eHealth digital services infrastructure we, the member states, have to create with these funds. And we said, okay, it's fine, but we talk about national contact points eHealth. The experts among you will remember that this is coming out of this pilot we had several years ago, EPSOS, where the technicians found a wonderful solution how we can organize the gateways between member states, national contact points for eHealth. So in the last meeting, it was also last week, we were able to pass an organizational framework for this national contact points for eHealth. And this was good, the member states came together at the table, sat at the table, and were able to draw, a guideline what this gateway, so to say, should be all about and how they should be organized. And we even were able to come up with a governance mechanism for us, the member states, and the European Commission to create that. So my point here is, if Greece is interested in participating, in building this infrastructure, join this discussion now. I was in Brussels yesterday, and we had a very good initiating discussion, if we should do it by ourselves, each and every member state, or if we should form a consortium of member states doing this together. There are pros and cons for both, of course, but we have to solve this problem, because the call is out. The Commission published the call for this eHealth digital service infrastructure, and we have to answer that call until March, so we have to speed up the process. But this is, a good example where member states come together and collaborate in a very, very productive way. But once again, friends, without this kind of infrastructure, without these gateways, for example, the national contact point for eHealth, that will never happen that we exchange a single health data across the border, other than doing it by sending it by email, which is, I think, telematically not very well. So I showed you some possibilities to where our travels go and where our travels lead. This is I think they put this presentation on the conference webpage, just to know how the dates is. And actually, it's already outdated, what I learned yesterday. So the grant agreements will not be signed mid-2016. They will be probably signed at the end of 2016. So we will gain a little bit of time. But ladies and gentlemen, this is the evolution, and I think the organizers of this meeting gave my little keynote here the right spin. It's an evolution, and I only can tell you, and this is my observation, that the collaboration between member states making progress, it's a good example. It's a good example that member states can collaborate on a very complex level, because it's a technical level, but it is possible. But it needs policy people, and I'm very happy that some of my colleagues in the capitals discovered the necessity not only to let the technicians work, because they always come up with solutions, but we also need the framing policies and also the legal aspects of these policies, and we are working on that hard. And I'm very happy that Greece always was an important supporter of this European development. And I think you benefited from this work in several instances. You know, you wouldn't have a good Greek e-prescription solution without all these experiences we shared on the European level, and vice versa. I would like to ask you all, observe these European processes closely, help us to make progress, and help us to support the public interest. And once again, there is a strong public interest that the exchange of health data is an enhancer of the quality of the services in the healthcare system. Thank you very much.
Ευχαριστούμε πολύ τον κύριο Auer για την εξαιρετική ομιλία του. Τον προσκαλούμε τώρα να έρθει εδώ στο πάνελ για να απαντήσουμε τις ερωτήσεις που έχετε θέσει ηλεκτρονικά. Μπορούμε να κάνουμε ένα έλεγχο να δούμε τι έχεις ερωτήσεις. Ωραία. Είναι και στα αγγλικά γραμμένες, οπότε διευκολύνει την περιγραφή. Νομίζω και οι τρεις είναι εξαιρετικές, μπορούμε να τις παρακολουθήσουμε και τις τρεις. Ναι. Θέλετε να κάνετε κάποια παρατήρηση πιο πριν, κάποια ερώτηση? Ναι, αν χρειαστεί, ναι. Λοιπόν, επομένως, να απαντήσουμε τις ερωτήσεις. Η πρώτη ερώτησή μας είναι do you believe that culture may be number one impediment to the adoption of e-health, or maybe the level of e-health infrastructures differs between member states? Δηλαδή, αν πιστεύουμε ότι η κουλτούρα παίζει ρόλο, είναι το πρώτο εμπόδιο για την αποδοχή του e-health. Αν μπορούμε να απαντήσουμε αυτή την ερώτηση. If you can answer this first question, please.
That's a good question, a very good question. I think the culture matters. You know, the culture of healthcare provider in accepting e-health solutions, ICT, matters, of course. But you know, each and every doctor uses a mobile. Each and every doctor uses some sorts, or had used that for a long time, some sorts of electronic devices and documentation system and so on. And I think the hospital doctors, the clinicians, so to say, or the people, doctors working in a clinical, in a hospital environment. I always have to be careful in German. Clinical means something different than in English. So in the hospital environment, the healthcare professionals are used to work with digital data. So there the cultural barrier is much lower than in the outpatient sector. The general practitioners mostly are the problem. I don't want to say the problem, but more reluctant. More reluctant, because they think that digital services take away time for the patient. And I think we have to prove the opposite. So I think these cultural barriers in the mind of some doctors has to be eliminated, and only can you eliminate that and overcome that when we prove, and that's industry has to help us there, to have user-friendly devices. It's all about usability. If it's usable, if it makes sense in the care process, in the diagnostic process, in the therapeutical process, then they will take it. But if it's not user-friendly, they will never take it. So usability can overcome cultural barriers. This is my experience, and this is my experience.
Now we can attempt the second one, Dr. Auer. Can you propose one or more regulation, legal incentives that could facilitate eHealth adoption? Αν μπορείτε να προτείνετε κάποια κίνητρα για την καλύτερη αποδοχή.
I don't know about legal incentives. Probably the fiscal incentives are more important than legal incentives. I think, once again, the legal incentive, so to say, is to create a legally sound and sustainable framework. A doctor, a healthcare provider, a nurse, they work, and that's good, and we shouldn't discuss that or argue that. They work on a high ethical standard, and if they have a feeling, a sound feeling, that the legal regulation to exchange digital health data is good, then they can find compliance with the ethical standards. So, we have to create, and this is a very complex issue. It goes deeply into the questions of liability, for example. Isn't that your experience as a policymaker? If I talk to medical doctors, one of the killer phrases always is, how does it affect liability? Yeah, it's important for them because they are scared of us lawyers. So, we have to prove that the legal ramifications are ramifications which don't put another burden of liability on their shoulders. So there is a good incentive. So, clarify their rationale that the use of digital data, the exchange of digital data, is another burden of liability. That's simple, because it's also a little bit culturally, but you have to clarify it. You have to tell people, and to be very precise and clear on that. So that would be a legal incentive, I see. Otherwise, it's money.
Thank you very much. The third question is, how far are from adopting the cross-border healthcare in practice? Πόσο μακριά βρισκόμαστε?
The cross-border aspect, and I think I mentioned some of the points in my speech. There are prerequisites, and I mentioned some. One prerequisite is a sound identification system, patients, healthcare providers in each and every member state. Without that, forget cross-border exchange of health data. One. Number two, we do need a certain understanding a shared understanding of profiles and standards. Without that, forget the cross-border exchange of health data. By the way, you need both elements also for the national exchange of health data. But on the cross-border, that's a prerequisite. And there are many, many other organizational and technical and semantic prerequisites. But so the eHealth network 2 years ago, 3 years ago, we agreed on, we adopted a guideline for the minimum data set of a patient summary for cross-border use. By the way, we haven't exchanged a single patient summary across the border, but we have a guideline. We agreed on that. That's good. But, we have to fulfill the prerequisites. we would know, theoretically, we know what the minimum data set of a patient summary for a sound and safe exchange across the border. But without the other prerequisites, we never will be able to do so. So I think many member states making progress internally so that we have then the capacity and the capability of exchanging cross-border health data cross-border, and we are still missing the gateway. This is what I talked about, which we now have a good accelerator, an incentive, a financial incentive provided by the European Commission with the CEF funds, because each and every member state who will participate will at least get, I don't know, 500K out of these funds, and that's I think decent money to build this infrastructure as a gateway to facilitate and then to exchange health data cross-border. So we do need that infrastructure, this gateway infrastructure.
There is a last question that just came in. Τελευταία ερώτηση. Based on your experience, do countries organize national contact points on regional or national level?
Yes, with EPSOS we had experiences, in a pilot environment. Please don't forget, EPSOS was a pilot. It was not real life. Sometimes the EPSOS people forget that. They think that was real life. No, it was a pilot. So I think EPSOS proved that the national contact points can work. And I think you had in the country here, you had a functioning national contact point, because I remember that we had showcases showing e-prescription going, I think, between Veneto or Lombardy and Athens. So it showed that it works. So this is, in a pilot environment, we had the proof of concept. And that's the reason why we are now able to deploy it in a general way. If we should regionally or European, in deploying and building now this infrastructure in each and every member state, we have to sort out. I think that we should do in the next couple of months. This was my remark. Should we do it all by ourselves? Should 2 or 3 member states join because they know that they have enough traffic between the countries, or should we do it in a larger consortium? I think that we should decide very, very quickly, and I think the pros and cons are easily written down and strategically sorted out. I personally would prefer a larger consortium, and I tell you why. Because then we get more cohesion in deploying and building the solutions.
Thank you very much. I think we have 2 more questions, but the people can answer you again question during the coffee break.